where are we here?
So this is a 3D hologic mammography machine. We use Bella blankets to where this is a little bit to where it's not as cold for our patients.
Oh, wow.
So the standard of care is 3D mammography for patients now.
Okay.
Some women will do still 2D, but we prefer them to do 3D just because you can find tiny, 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 tiny cancers.
And I hear more and more about dense breasts, and is that
so
an
3D
advantage?
was invented for dense breasts. So 3D is the best standard of care for women that have dense breasts or just in general, you know, women that just need a mammogram. So we recommend women have mammograms once a year after the age of 40. If a woman's family history, let's say you had a sister or a mother that had breast cancer at 35, they recommend their daughter to start screening mammography at age 25.
So let me restate that. What I hear is if there is a history in your family, the time to get the mammogram is much younger.
Well, if you have a mother that was diagnosed with breast cancer at 35, then they would recommend 10 years from the time they were diagnosed to have that mammogram.
How long does it take to get a mammogram?
So 15 minutes.
Okay.
You have the compression, which this is what all the women complain of. So, you know, we have to compress them enough to where we separate 3 layers of breast tissue. So, of course, women, you know, sometimes have a little bit of an issue with that. Honestly, it's a little sore for me, so I sympathize with women that are very uncomfortable when they have to have, you know, a mammogram, and it's not the best thing, but it doesn't last long.
Correct.
And it is so life-saving to where every single woman needs to have a screening mammogram.
This is so interesting. So moving on, what would be next?
So you have screening mammogram. This room right here is just strictly for screenings or diagnostics.
Okay.
We have another room I'll take you to that is where we do our breast biopsies with mammography, and I can show that to you.
Sure, and as we're walking, once this the mammogram is done, does it go then to the radiologist?
Yeah, so our technologists that are very trained will question you and they'll get your history. Once they're finished with your mammogram, they send it over to the radiologist. The radiologist has their own special computer to where 3D, they can kind of scroll through it to be able to look at that mammogram extremely like detailed because it's small little millimeter slices that we're looking at, whereas down the road, long time ago when we did only 2D mammogram, we didn't have that capability, and that's the reason we're finding cancers at very, very small millimeter sizes.
So it really is a pretty, the protocol is very rigid about what happens and how it happens.
Right, yeah.
Amazing.